Welcome to Maximize Living. I'm Dr. Patrick Andersen. Maximize Living is a group of over 450 doctors dedicated to improving your health naturally without drugs and surgery. Maximize Living doctors are the official chiropractors for USA Wrestling, USA Track and Field, USA Weightlifting, and a host of other organizations. But this isn't just about athletes performing better, recovering faster, or having less injuries. It's about you maximizing your life. This week's focus topic is neck pain. According to the World Health Organization, 1/3 of all people have neck pain today. Stay tuned as co-host Stacy Hansen and myself demonstrate what cervical spine exam, x-rays, and rehab exercise look like when evaluating neck pain. I think you'll be amazed at the science behind what a chiropractor really does and why it's so effective. You've heard about it, now let's learn about it. For Maximize Living, I'm Dr. Pat. Stay tuned, we'll be right back with answers on neck pain.
And welcome back to Maximize Living with Dr. Patrick Andersen. So Dr. Pat, you mentioned that 1 in 3 people have neck pain. Where is this coming from?
Comes straight from the World Health Organization. They said that 1 in 3 people in the entire world have neck pain on any given day. And it's an epidemic problem. And it's because of 37 joints in the neck. They all have to work in unison and move and glide and slide properly. And when our necks are out of alignment, they don't function well. So the actual pain, where the pain actually comes from, people think it's in the muscles, but the muscles don't have very many sensory fibers. That's really not a high pain producing area. The muscles do get involved, but not the primary pain site. The primary pain site is right in around the joint, in the ligaments, which aren't shown here. Ligaments are highly innervated. As the joint misaligns, the ligaments are stretched, and that causes a lot of pain. But also, recently, in the last 10 years, we've discovered that the outer 1/3 of the disc is highly innervated and causes pain. We used to think for many years the disc wasn't pain sensitive, but the outer 1/3 of the disc has pain. So it's not in the muscles, it's in the disc, the joint, and the ligaments. That's where the pain comes from.
Wow, I did not know that. You always just assume it's pain. You know, people want to take an ibuprofen or something like that, and here it could just be...
It's mechanics.
Wow.
In the vast majority of cases, yeah.
So there's all these people out there with neck pain. Where's this coming from, or how are they getting these injuries?
We get hurt a lot of different ways. You know, the first and foremost way people get hurt is from birth.
Can't avoid that one.
Yeah, exactly. But the neck often has a lot of pressure on it coming through the birth canal, especially if there was a forceps delivery. That is extremely hard under a suction vacuum. But falls as a child. The average child falls several thousand times.
Oh, yeah.
Now, they can bounce better than adults, but it's still a lot of falls. Long sitting at a computer, slumping with the head forward is hard. One-sided sports, like golf or baseball swinging, always one-sided swinging is hard on the neck and back. Of course, falls, and then car accidents. 1 million new car accidents every year can jolt and jerk the neck. And while it may feel better for a while, it often isn't quite right, and then comes back again and again. So chronic injury from neck problems. Bad pillows.
Yeah.
You know, propping your head up abnormally for hours on end. Heavy overhead lifting. People lift heavy, they can strain their neck. Propping your head on the end of the couch when you're reading. Reading in bed with 2 pillows, sorry about that one. But propping your head forward strains the neck over time. So if you're going to read, do it sitting up, not in bed. It's hard to read. I can't find a good way to read in bed. Same with watching television. And if you want to try to watch television that way, you could probably mount the TV on the ceiling and lay flat on your back, but that's about it. So computer use is a big one.
And a lot of it is just kind of our culture today. That's just the way we live. You know, you got the computer. Yeah. We're not meant to sit at desks.
About 3 hours a day, and more than that, it's hard on our neck.
Yeah, so tell that to all those corporations out there. Make it a 3-hour work day. So when someone comes into you with neck pain, what are you most concerned about? They're concerned about the pain probably.
Right, well, we're concerned if it's going to go down their arm, if it's causing headaches, if it's involving the TMJ, the other joints involved, shoulder, elbow, wrist, or mid-back are all part of the complications.
So what are you looking for then when you're trying to evaluate someone for the neck pain?
Well, we're looking at their posture. Posture will tell us a lot. We're looking for their range of motion, their strength, orthopedic tests. But one of the things we really look for is a curve in the neck. There should be a 43-degree arc in the neck for a curve, and we lose that curve, it stretches the spinal cord. But just as important is forward head posture, as this poster depicts. For every inch forward, so the center of the ear should be directly over the center of the shoulder. And for every inch forward, the head weighs 10 pounds more mechanically. This is published in the literature. So many people are walking around with a 10, 15, 20-pound hat all day long, rounding their back and pushing their head further forward, almost like they're turtling and their head sinking into their chest, into their thoracic cage.
Ouch, I think I read an article on that recently, and they were calling it phone neck because everyone's always looking at their phones. They're walking around like this.
Not a good posture.
So stay tuned. Right after this, we're going to talk how you can fix some of these things. Welcome back to Maximize Living with Dr. Patrick Andersen. So Dr. Pat, we were talking about neck exams and how you may not know that you've got an issue because you might not have pain. Can you do a checkup on me?
I would love to.
I can find out, and the viewers at home can kind of see what this entails.
You bet.
So what's first?
Let's have you face that way.
Okay.
And what I'll do is start by looking at your posture. Posture is a window to the spine. Posture always looks like the x-rays, so we learn a lot just from posture. So first things I'm going to look at is to see if she has forward head posture. We're looking to see if the center of the ear is over the center of the shoulder. And then we're looking at the neck from behind to see if it's completely vertical, if there's any angulation. And then we're looking at shoulder height. And once we've checked posture, then I'd ask you to come have a seat right on the edge of the couch.
Okay.
And we do some orthopedic testing. Orthopedic tests are just stress tests where we stretch a joint to see if there's a problem. So the first one is done like that, shoulder depressor, and then we do it on the opposite side.
Feels kind of nice, actually.
Good.
It's a nice little
This
stretch.
one's called maximum compression, where we load the neck. And if there's a problem in the cervical spine, it'll often cause discomfort. And we do that on both sides. And then next we test range of motion. So I'll ask you to turn your head this way as far as you can. And we're looking for about 80 degrees of turn both ways. Turn this way as far as you can. And we're looking to see if you turn fully or if there's any discomfort, stiffness, tightness, or pain. Good. Next one is forward flexion. We're looking for 60 degrees of forward flexion without neck pain. And then backwards as far as you can. And that shouldn't hurt to lean back and then put a light pressure on it. About 50 degrees of neck extension is normal. So anyone in a car accident or a recent injury, they're not going to have good tests on many of these. And what's amazing is how many of the tests are bad on every one of them when someone's having a problem. The next one is side bending. This is often limited on people because it's a complex movement. Side bending the head should go 40 degrees each direction. And so we mark that if it's painful or limited in any way. Next, reflexes are very helpful. That tells us how the nerve is working from the spinal cord. So we do a biceps, a tricep, and a digital, like playing the piano. And the same thing here. Check that, biceps, triceps, digital.
That just reminds you how everything's connected. It's not just your neck.
Yeah. Now if you have a disc rupture in your neck, you can often lose your reflexes and your strength from doing that. So now hold your arms straight out. These are pinwheels, and this will test your sensation.
Oh yeah, I feel that. It's prickly.
All different nerves, palms up in the air. All different nerves we're testing, so we're looking for one nerve being more sensitive than another. Good.
Yeah,
Good job.
that's about even.
Now I'll ask you to hold your arms out like this. We'll do some shoulder strength testing. Bicep, tricep, shoulder strength. Bicep, tricep. Flex your wrists, hold, don't let me straighten. Extend your wrists, don't let me straighten. Curl your fingers, don't let me pull. Spread your fingers wide, don't let me push them together. So those are all tests that tell us. Now if you would lie on your back, I'll check your leg length. And we look to see if the legs are even. If there's subluxation or misalignment in the neck, you'll often contract the long spinal cord tracts and you'll shorten one leg.
Oh, wow.
Yeah, it's quite fascinating.
Is that something you'd even notice?
You may or may not notice it, some people don't. Now raise your head. This is a very important test in strength. Hold right there, don't let me push down. And turn this way, hold as hard as you can, don't let me push. So we're looking for that, we grade that in 10% increments. So a 5.0 strength would be full strength, 4.5 would be half strength. So we rate that for each person. Then lastly, we palpate the neck and feel for any misalignment that we can tell and any tenderness of the joints. And that's a typical spinal exam. We'll be back with a demonstration of x-rays in just a moment.
Welcome back to Maximize Living with Dr. Patrick Andersen. So Dr. Pat and I have been talking about neck pain today. You just did an exam on me. Now between the exam and the x-ray, that's kind of how you're diagnosing these things?
Yes, but we also look at the patient's history, what happened to them, the number of traumas they've had in their life, stresses they have, job, occupation, and we look at their current symptoms and we put all that together to come up with our best diagnosis. So x-rays are part of the picture and an important part of the picture.
A good pun there too,
Yeah,
picture.
yeah, I didn't realize that.
So this fellow here, he's okay?
He's actually in pretty good shape.
Yeah.
So here we have no forward head posture. So the center of the skull mass is over C4, a little technical there, but that's what we measure. And keep in mind that every inch forward is a 10-pound hat all day long. So that's hard on the body. And we look for a good cervical curve. That's normal. And that's what the spinal cord likes. There's no cord or brainstem tension when you have a good curve in your neck like this. And so many people lose that as the first thing that goes wrong. And then we look at the skull angles and the atlas, top vertebra angle. And then we look for this C2, the second vertebra, to be really level. Now I know this sounds kind of complex to people, but when you see some of the ones that aren't good, it's going to make a lot of sense to you and you're going to just cringe when you see some of these other ones. So here we're also looking for a good disc space between each of the vertebrae. We're looking for nice square-shaped vertebrae, not too rectangular. As they degenerate, they often flatten and pancake and get more rectangular shaped. So here, this is the left side of the person. You're looking at them from behind, and here we measure is the top vertebra in good alignment. We want close to 90 degrees or 0 degrees misalignment. We want the lower neck to be completely perpendicular to that top vertebra. So that would be a normal measurement. And then we go from mid-neck to upper back. We want that completely in alignment there, and then we go from T2 down to T7. We want that completely in good alignment. And that tells us that neural canal has got a nice clear opening. You start wrenching and turning that in all the different directions it happens, it spells a lot of trouble for a person.
So this guy's all lined up, pun intended this time. Now, what about somebody that's maybe not doing so well? Can we take a look at an x-ray and just kind of see the difference? Oh yeah, you've got some angling going on there.
That we've got angulation going on in here, and especially off in the mid-back.
Oh sure.
And so that's abnormal, and that causes discomfort for many people. This was actually an 8-degree angulation. So alignment matters because all day long this person functions from an abnormal base. All their movements are crooked, so everything is tilted. So imagine golfing when you have a spine like that, how much easier it is to hurt, or how much more fatigued you get. Or doing household chores, vacuuming, raking the leaves. All those things make a big difference. Got to have good alignment for body function. Now, what do you think of that?
Well, it's kind of a straight shot there, isn't it?
It's actually going the wrong way.
Yeah.
Minus 17 degrees. So we said you should have a 43-degree angle here, and we're at minus 17.
That's some pain there.
And this should be level, we talked before. This is down 25. So it's actually taking that spinal cord with too much extension on the skull, going like this, and C2 doing this too much. It actually puts a lot of pressure on the brainstem. This is a problem case.
So this has really shed some light on a lot of things here. So coming up next, we're going to talk about some exercises that you can do to help get things back where they should be. Stay tuned. And welcome back to Maximize Living with Dr. Patrick Andersen. So we've talked about how you get neck pain. We've looked at the exam, the x-rays. There's also a step 2, the adjustment.
Yes, it's the most important thing we do is actually correct the spine with a physical adjustment. It's very safe and effective, and it's not really even considered painful. They're like forces we apply to the spine that shift those vertebrae back in place. We use an instrument to do that and part of that care. We have drop tables to do that, but we also use things like isometric exercises on certain parts of the body, one-sided, to help correct the spine. And we use spinal molding techniques with rolls under the neck and back, and so there's a whole host of other things that we can do. There's even one where we use body weighting with a head weight in the front of the head that actually helps pull your posture back. So that's something you walk with for a few minutes a day. But let's go through some exercises.
Yes, let's do some exercises. I'm going to do them with you and maybe on my own. I don't know, you game?
Would you lie right on your back?
Okay.
And the first one is called 1-inch head suspension. Now, it's really not an exercise if you're not moving, right? So in this one, we ask you to hold your head 1 inch high, like that. And you hold that for the rest of the day. No, you hold that as long as you can. 1 inch high, go down just a little bit lower. It's hard, chin down a little bit.
It's
right
harder
there.
than it looks, folks.
And after a person has an injury in their neck, they're not very good at this one. So it's a great way to strengthen the neck without straining the neck or going through a lot of motion if motion hurts. All right, the next one is a neck extension exercise, if you wouldn't mind sitting facing that way. And on this one, this really helps with the cervical curve. It helps the roundness in the upper back. And the way this one's performed is to put the hands behind the head, clasp the fingers fairly high in the head. A lot of people make a mistake, they go too high. And what we do with this one, it's simply a stretch. We want to stretch the chin and elbows as high as you can. And you'll feel that pulling all the way down the spine.
Oh, yeah.
And you do 5 to 10 reps, 5 to 10 seconds. And you do that a couple times a day. And again, there's no pulling with the hands. It's more of a stretch than anything else. You'll love this. It's great when you're sitting at a computer and having trouble.
Oh yeah, that would feel great after a long day at the office.
All right. The next one, we're going to have some fun with some things called sit discs.
Ooh.
And what we'll ask you to do is sit on this. These are great to sit on in the office. And it's like a ball, only not as cumbersome. Yeah. And kids can't go flying around on them as well, which they do if you leave them around. And sit disc, this keeps your back wobbling while you sit. But we use them particularly for exercises, warm-ups in our office and at home for patients. So the first thing is we want to get flexion and extension in the spine. So this is going to look a little silly, but we want to do good work for you and show you what it works.
Anything for TV. All right, here goes.
What you do is you rock back and slump, and then you rock forward and arch.
A chiropractor telling me to slump.
Yeah. You won't hear that very much from a chiropractor. But what you're seeing here is flexion, extension, full range of motion. And the secret with this is you're really going as fast as you can. And you can see your spine will get work that it normally does not get. The next exercise is a side bend. This one's a little harder, where you shift to one side and tip your head away. And then shift to the other side and tip your head away. And the funny thing about this one is you try to go as fast as you can, and we'll never look any better on TV than this.
Those tuning in just now are wondering what is going on.
But what a great exercise, because the neck and mid-back are so constricted by the rib cage, and this helps get disc circulation, opening up the discs. It actually helps with your height, that you don't shrink as much as you age because you're getting regular movement. So we do 20 reps of each of these. And the last one, putting your arms up in the air like this, it arch your back, and it's a rotation movement. So we're really covering all 3 planes. We'll try not to knock each other out here.
Yeah, I'll try to stay synchronized here.
But you turn your head as far as you can. If you get dizzy, leave your head in the looking forward and just move your body.
I feel like a genie.
Exactly. We'll see miracles pretty soon here. When you're moving like that, you're actually taking that disc and unwinding waste products, getting waste products out of there and imbibing new fluids in to help keep that disc healthy. So those 3 exercises are wonderful warm-ups.
It feels really nice. I can really feel it already. I feel more limber. Well, stay with us. We have more coming up right after this.
We covered a lot on neck pain today. We talked about common ways people hurt their necks. We described what you do in a typical exam. We demonstrated misalignment measurements on x-rays. We talked about different styles of adjustments, and we demonstrated exercises that are good for both prevention of neck pain as well as rehab. Don't be one of those that live with neck pain and limitations for years without getting a checkup from a good chiropractor. You'll be happy you did. Delay usually allows for more degeneration or complications to develop. As our show demonstrates today, there's so much more science to chiropractic than you may realize. We may very well have the answers for you. If we don't, we'll refer you to another doctor. If you'd like me to personally evaluate your neck, spine, or extremity condition, call 608-833-1282 today or schedule online at madisonml.com. For Maximize Living, I'm Dr. Patrick Andersen. Live well and God bless.